everyone, welcome to Anatomy channel. I am Dr. Monisha. Here we are about to discuss 10 questions on the regions of head and neck, 10 random questions. Okay, so here you can see the most prominent point in the occiput called the external occipital protuberance, and here you can see the two convex lines, the superior nuchal line, and the muscle that originates from the external occipital protuberance is your trapezius muscle. Here you can see the trapezius muscle originating from the external occipital protuberance, the spine of the cervical and the thoracic vertebra, and has its insertion to the clavicle and the scapula. Okay, so we'll see a question based on this. Trapezius muscle is attached to all except, and when they mean attached, it includes both origin as well as insertion. Okay, so the origin is from the external occipital protuberance, insertion is into the clavicle scapula. So which is the answer? The first rib is the answer, which is not involved in the attachment of trapezius at all. And the second point I would like to discuss is about the ligamentum nuchae. It is a fibroelastic ligament. It is a fibroelastic ligament that extends from the external occipital protuberance. Okay, it extends from the external occipital protuberance to the spine of the seventh cervical vertebra. To the spine of the seventh cervical vertebra. This is your ligamentum nuchae, and sometimes they say that it is the extension of the supraspinous ligament. Okay, so when we discuss ligamentum nuchae, I would like to discuss some additional points about the ligaments between the vertebra. Okay, so here you can see the body of the vertebra, and in front of the body of the vertebra you have the anterior longitudinal ligament, and posterior surface of the body of the vertebra we have the posterior longitudinal ligament. This is your posterior longitudinal ligament, and here and between the spinous process, this is your spinous process, you can see the interspinous ligament, and above your spinous process you can see the supraspinous ligament, as the name itself says. And between the transverse process you can see the intertransverse ligament, and between the lamina of the vertebra, see, you can see here between the lamina you can see the ligamentum flavum. So we'll go to a question based on this. During lumbar puncture, after piercing which structure, the needle will enter into the epidural space, that is just outside your spinal cord. Okay, and the needle enters which space? You are piercing the skin, and then you are piercing the supraspinous ligament, interspinous ligament, and then you are entering, and here is your ligamentum flavum. And only when you pierce the ligamentum flavum, you will enter the epidural space. So the answer here is the ligamentum flavum. And supraspinous ligament, interspinous ligament comes in the competition, but ligamentum nuchae doesn't even come in the competition because it is in the cervical region, and most often the spinal is not given there. And in this picture you can see the levels of various prominences in your body. The hyoid bone is at the level of C3, the thyroid cartilage is at the level of C3, C4, the upper border is at the level of C3, you can say, and the cricoid cartilage is at the level of C6, okay, specifically at the level of C6, and suprasternal notch is at the level of T2. Okay, suprasternal notch is at the level of T2. Okay, so these are things you must remember. So body of the hyoid bone, you can see the body of the hyoid bone is at the level of C3. Okay, the pulsation of the common carotid artery is done at any artery in our body is palpated against a bony prominence. So the common carotid artery is palpated against a bony prominence called the Chassaignax tubercle. Chassaignax tubercle. Chassaignax tubercle is a tubercle on the transverse process of the C6 vertebra. C6 vertebra transverse process, you have a tubercle called the Chassaignax tubercle. Already we saw that C6 vertebra level, we have the cricoid cartilage. Yes or no? We have the cricoid cartilage. So, in other words, you can say the pulsation of the common carotid artery is done at the level of lower border of cricoid cartilage. In other words, you can say that it is done at the level of C6 vertebra is done against Chassaignax tubercle. You can say that. In other words, you can say that it is done at the level of lower border of cricoid cartilage. Common carotid artery divides at the level of, in this picture you can see the common carotid artery divides into external carotid artery and internal carotid artery at the level of upper border of thyroid cartilage. At the level of upper border of thyroid cartilage, which is at the level of C3 or C4. Okay. So, it is at the level of superior border of thyroid cartilage, which is the most prominent spinous process. Here you can see in this person, a very lean person, you can see the most prominent spinous process is a process of C7 vertebra, and that's why it is called vertebra prominence. So, it is a C7 vertebra. Thank you guys.